Thank you very much, Dr. Carol, especially for, widening our imagination and appreciation for the parents. Our grand finale for this afternoon is a presentation on Deeping the Stereotypes, Development of a Transdisciplinary Sexual Literacy Program for female leaders and young adults with developmental disabilities. This is authored and will be presented by Dr. Marie Grace A. Lopez.
Thank you very much for that very warm introduction. Background of the study, I've been studying on gender and sexuality issues of persons with disabilities since 2014. I started on studying how sexual behavior of deaf adolescents affects their perceptions of themselves. And of course, I examined on the danger. I also have a study on the risky sexual behavior of gender non-conforming students, and this contributed to a lot because during that time I was called by a school educator children, and they said that there were people who were gender non-conforming, ages 22 to 27, who were dying of pneumonia. And if you die of pneumonia and you are young, that is quite impossible. So we investigated and we identified a lot of risky sexual behaviors. And we created a sexual health literacy program for them in order to address the issue. Next slide, please. I'd like to thank the UP Center for Women and Gender Studies for this study, for giving me funding for this study. Otherwise, I won't be able to continue it. Yeah. The original study is one of the recommendations of the Disability Inclusive Comprehensive Sexuality Education in South Asia and the Pacific. This is a regional study that I belong to. I was lead researcher on the Philippines. But primarily, the focus of the study was people who had mild disabilities and those who had severe disabling conditions, particularly those with cerebral palsy and those with autism and intellectual disability from moderate to severe range for the gifted. And according to the recommendations of the committee, we were three in the study, Nepal, Mongolia, the Philippines, and then we also had correspondents from Indonesia, from Malaysia, and Thailand. All of us also recommended that those with moderate to severe disabling conditions should be further studied. Next slide, thank you. So I'd like to give a cognitive profile of persons with intellectual disability. So if we have moderate intellectual disability, the IQ is 36 to 49. If it's severe, it's 25 to 35, meaning you have your mental ages of people ages 16 to 25 years old at this level. So probably their IQ age is of a 5-year-old child, a 6-year-old child. But they are in an adult body. That's why you have to address the sexual needs. And of course, a lot of people think that children, that adults with disabilities are asexual. Chapter said in his research that people with disabilities, even with severe disabilities, will find sexuality whether you teach it or not. So here I did a study on sexual health literacy for students, for teens with moderate to severe. Initially, I only intended to utilize female teens. But in the study, there were parents who had other children, who have several children who have disabilities. And they said, how about my boys? So include my boys also. And we want to help our students, our children. So I came up with, I omitted female because there were male students with disabilities in the sample. Next slide. Thank you very much. So these are the objectives. So identify have parents who have children with intellectual disability. Primarily because those with moderate to severe disabling conditions are non-vocal. They cannot use language, but they can point and they can read pictures. And then identify teacher training needs. Because the teachers would say, I'm a virgin. Why? What would people think of me if I teach sexuality to my students with intellectual disability? They might think I'm promiscuous. identify curricular priorities, identify barriers, and we have a sexual health literacy program. I have created a comic book on dating. So the task analysis for dating, and this was given to a division in Metro Manila. Next slide, please. Thank you. It follows the biopsychosocial framework of the WHO. I would like to have the AID framework. However, we are in special education, and we always abide by UNESCO and WHO. That's why I'm using the biopsychosocial framework. Next slide, please. Thank you. These are the laws that are relevant, and these justify the need for a sexual health literacy program for persons with intellectual disability. You see, even in the Philippine AIDS Prevention and Control Act of 1998, the persons with disabilities are supposed to be included in AIDS care, AIDS prevention. Next one. Thank you. It's qualitative thematic analysis, and we made use of a lot of activities and interviews. All the interviews were done via Zoom because of COVID-19 restrictions during that time. Next slide, please. Thank you. Of course, it was difficult, but a lot of the schools told me, since you know about sexual health literacy, could you please make a program for us? Could you please include us? We will review it. The principal, the school board, and of course, the parents reviewed all the protocols, all the questions, and they said that it was very relevant. So they gave me consent ASAP. And of course, there was informed consent for everyone. This is the profile. I was able to interview. Next slide, please. Thank you. I was able to interview 145 people. There were FGDs. It was a recommendation by the referee to have a person with disabilities talk. And since I had difficulties with having people with developmental delays, I know a deaf ed official who has Asperger, and he talks openly about sexuality. So I invited him, and he gave his piece of the story. And then I had Metro Manila, Bulacan, Ilocos, General Santos City. These were the three areas. Next slide, please. So the significance. First and foremost, it is for safety. There were some participants who said, teachers, there was a student of mine that said, my uncle touched my cookie. So the teacher said, cookie. Oh, so it's the one that's being eaten. So after 6 months, it said, cookie, cookie, cookie. So the teacher said, what is this cookie about? Point to your cookie. So the student became her vagina. And apparently the student was being molested, raped by her uncle. So for safety, number one. Sometimes also kids who have the sexual urge to masturbate in public bathrooms. That is how they get raped because they do not know the proper place. It should be only in your room. You don't need to give the things masturbation. If the child starts touching himself or herself, you say, only in your room. And then, when you're done, clean up, wash up, brush the toilet, and that's it. Because you need lesser explanation because they have little knowledge on it. For males, it's preparation for circumcision so that they will not cry, and then preparation for menstruation and to avoid teenage pregnancy. Because indeed, some of the girls who have intellectual disability would be curious on how to create a baby. And they would go and find their sexual partners. And they would be so surprised that giving birth is difficult. So you need to avoid teenage pregnancy. Next slide. So these are some verbatim responses. Kahalagahan ng pagtutuli. Next po. Okay, kailangan niya maging ligtas sa pang-aabuso. Next slide. What are the priorities? Number one is to name the body parts related to sexuality. I talked about that. Expression of romantic feelings and dating. You don't just kiss other people. The sense of propriety. You don't touch other people's private parts in public. You have the issue of consent and of course masturbatory behavior, whether it's female or male. Next, these are the verbatims, okay? Self-stimulation, and even the parents identify the need. Next po. Okay? In the literature, it says there are times when masturbatory activities can be a form of sensorial stimulation. Yeah, it's just a stimulation. It doesn't necessarily mean that they have sexual feelings. It can be sensorial stimulation. So there's no moral no value here. Next one. Thank you. Barriers. The very conservative view, okay? The teachers think I'm a virgin, the stereotypes on teaching sexuality, religious views, the fear that I might teach the wrong content, and unfamiliarity of the content. I really don't know how to teach it. Next one. So, yes, Griselda. And a lot of teachers would tell me that, virgin pa ako, no? Sasabihin nila sa akin. Next po. So, this is a very conservative view. We should teach our values and our religions, and the sexuality issue should be taught based on a cultural and religious view. This is a quite conservative point of view, but at least he is amenable to teaching comprehensive sexuality education. Next one. Paano ituro ng tama? Fear is a hindering factor. Now, this is the sexual health literacy program that I developed. Next po. So first, you have legal foundations. You can have the law provisions in picture format. The UNCRTV has an easy format for people with intellectual disability. Next would be naming the government programs. I also recommend an easy read format and identify how you can get sick, the nature of STIs, and you can teach that to persons with intellectual disability. Next po is lessons on naming the body parts in English or the vernacular, developmental changes, preparing for puberty, relationships, dating, safe and unsafe sexual practices, safe masturbatory behavior, and consent, and of course, sexual abuse. Next po, what are the culturally acceptable practices regarding sexuality? You can also teach that at a community or family level. Next, and then the economics of it, to identify institutions and point persons that can support the promotion of healthy and safe sexual practices. So these are components of the sexual health literacy. So, four recommendations. Number one is a sexual health literacy should be applied, and of course, it is in accordance to the UN Convention on the Rights of Persons with Disabilities. Next po, cultural and religious barriers can be discussed, and we can work with religious institutions. In preventive education, we have a faith-based approach because there are faith-based organizations that are interested. Perhaps if this is disability, they would also be interested in providing sexual health literacy, and they would be more enlightened on the nature of persons with moderate to severe intellectual disability. Debunking the myth that persons with disabilities are asexual, and then the safe and appropriate expression of sexuality-related behavior is necessary to prevent abuse. So with that, I'd like to thank you for the research in critical disability. I'd like to thank you for listening. Maraming salamat po. Thank you.
Thank you very much, Dr. Ross. We are now going to listen to the reactor we invited. That's Professor Maria Zamora of the UP College of Education. Prof. Zamora, our teacher Ichi, is an assistant professor at the College of Education. He holds a bachelor's degree in secondary education, a master's degree in education, and a second master's degree in special education. In addition to teaching, she serves as the health education liaison officer at the college, a member of the drug education committee, and the executive secretary of the Training Center for Preventive Drug Education. She's also a member of several professional associations, and she's passionate about teaching service, and this is evident in her involvement in research, development of IEC materials, and participation in various extension activities, such as the advocacy and promotion community-based programs, seminar training workshops, development, international conferences, and webinars. She's also an advocate for persons with disabilities, participating in events such as Angels Walk, and serving as a resource person for art for special children She has been trained with each mental and behavior modification within school foundation incorporated and is an advocate for preventive drug education, health literacy, and life skills. Additionally, she volunteers as a PSB psychosocial support worker. Thank you very much.
Hello, I'm Cecilia. Um, I was really ecstatic to be invited to be a reactor for my dear colleague in the College of Education. It has a great spot in my heart. No? Kasi actually, let me just do an acronym. Let me just give my reaction. S. It's very solid. No? From of the objectives, the methodology, and of course, he really pointed out na hindi porket may disability, hindi na nakakaramdam, wala nang rights for a healthy and quality of life ng mga bata. Well, naka-form siya dun sa sexual therapy literacy. Kasi nga, lumabas sa research at based on my experience as a sped teacher na from 15 to 26 years old yung hawak ko niya sa self-contained class. Nandun yung grammar talaga. Ito yung mga elephant na ayaw pa-usapan, even the parents. No? May IEP program kami na piniped yun as a goal. Paano yung, well, she mentioned masturbation, dating, and really expressing oneself in appropriate ways. No, meron silang, they develop crushes. Ang problema lang yung touch. Hindi nila alam how to express their feelings or minsan sa touch, teacher, you're so free. Minsan lang, hinalikan ako dito. Wala, bilang teacher, huwag mo na lang bigyan ng mali siya, but instead correct. Well, you redirect the inappropriate sexual behavior into a more appropriate behavior. You mentioned sexual health literacy. Magandang programa yan. Nagagawa yung magagawa. Pero kami, my experience as a STEM teacher, IET yun individual educational sana, ina-target mo. Itong tatlong estudyante out of 8, teach about expressing sexual feelings, properly. Ita-target mo yun. Ang isang ginagamit namin, I think kailangan i-mention ni Dr. Gomez sa research, circles of sexuality. No, may paraan paano ituro ang proper touch, proper reading without malice to the child, and of course not preventing him to express his feelings, pero proper lang. Organized. No? Nakita niyo naman yung presentation, she went to a lengthy qualitative research. Maganda yung questions niya. She was able to answer them properly. A, for applicable and authenticity. Very authentic yung mga minention niya, mga experiences ng magulang, and I can testify and validate to that. Kasi naranasan ko, na-observe ko, ang hirap challenging, teaching special children without any malice at all because it's part of the condition. Kasama yun kulang sa kanilang understanding. Of course, behavioral din kasi yun How do I express? So, ang pagtuturo, it's not only in the curriculum, but you bring it down to the parents. Turuan sila ng tamang paraan. Teach how you, paano ba ipagdad yung masturbation? Tama, we let the child go through it. But provide a safe space for doing it. Do not condemn the child kung negative ang bastos niya. Hindi dapat ginagawa yan. Instead, help promoting nga ituro mo yung tamang paraan. Okay? Art, very relevant. Sad to say, ang tingin lang natin sa mga special children ay gano'n na lang sila. But they can be productive. And let's make it a lifelong objective for everyone. Hindi kilala kayo na may special needs sa pamilya niyo meron, educate yourself first. So tama yung literacy program. Literacy is beyond reading, writing, math. It's health-based. Tingnan nyo yung pagkatao muna. So, to summarize, SOAR. S for solid, O for very gentle and organized, A for applicable and very authentic, and R for relevant. And it's worthy of your grant. Thank you very much.
Dr. Zamora, Professor Zamora. Okay, so there you have it. Those are the 7 presentations of our 7 researches. We are not going to go into the open forum, so may I keep track of mine?
So, anyone who has a question, they can. Anyone who has a question, they can raise their hand, and we'll give the mic na lang po and then you can speak to the mic, and then the speaker will si Tanya lang hindi makakasagot kasi hindi siya nandito, and hindi rin siya nasa online video yung pinanood natin kanina. So for our online participants, please put your questions in the Q&A. Apologies for the slides earlier that hindi pala nakita ng online participants natin yung slides ni Dr. Gomez. Anyone from the room? Even our reactors, if you want, ay yung kanina po, yung kanina yung meron po kayong tatanong or sasabihin kanina.
Good afternoon po. Ako po ay personally mas more iron practice sa oral malalim, especially sa person with disability. Yung presentation po ni John Anja ay malinaw. Pero habang ang panahon ay lumilipas, nadadagdagan. It's getting deeper and deeper. Kasi po, ang datos ng person with disability is not decreasing. It is increasing. Like for us, for example, sa Kaintarisal, yan po ay tumataas. Ang tumataas pong case ng disability ngayon ay ang psychosocial disability. Dahil kung sa nangyaring nakaraan na pandemic, at saka siguro hindi sila maka-adapt sa mabilis na takbo ng modern world natin ngayon. At ang isa pang tinatataas ng ating datos ng disability ay yung po sa mga bata. Sa PEDA, Developmental, dyan. Marami po tayo yan. Minsan nag-attend ako ng seminar with Secretary Erwin Tulpo. Almost nasa 8 million na po ang ating datos ng mga bata with special disabilities. So, yun po, at natutuwa rin po ako sa sinabi ng dalawa na tungkol sa sexuality ng mga bata. Sa bagay, hindi ko naman kilala, no? Pero tama po yung diniscuss nila. At nagkaroon po ako ng idea, next year, gagawa kami ng programa para sa mga carer. Dalang po ay presidente, ang Barangay Santo Domingo Person with Disability and Carers Association. Ilagay ko po yung 10 carers kasi po, halimbawa, ang magulang ay cerebral palsy at alam naman natin ang cerebral palsy ay may intellectual disability. So the parents will stand for their rights, the parents will be their voice. Kaya nagkaroon po ako ng idea, siya po ay officer ng National Cerebral Palsy of the Philippines. Siya po ay isang cerebral palsy. Kaya po siya sinama. And then, nagkaroon ka, sabi ko nga sa kanya, next year magiging project natin para sa mga carers, na mga nag-aalaga ng special child. Yung tungkol sa sexuality ng mga bata, kung ano yung importante na dapat pinangangalagaan ng isang batang babae na may special disability, katulad ng mga cerebral palsy, autism, psychosocial. Like, in-experience po ako, sa bagay hindi mo naman siya kilala. A teenage psychosocial, was attempted by discussing of her own case. Yan po ay nilapit ko sa Pausi. Unfortunately, kasi kamag-anak ng atay yung batang lalaki, so hindi ko yun na-post. And then, one time, pinakita ko, apo niya yung inalagaan niya. Pero at the age na 12 years old na yung batang babae, madumi yung harapan ng teaser, dapat ginanyan na. Pero ginanan niya. Pero alam natin na hindi na yung dapat sa age of 12 na isang batang babae. So, maraming salamat para including us in this symposium. Maraming salamat sa invitation because marami po kami natutunan. Napakalalim po ng symposium. Maraming salamat.
Thank you. So, meron pa po bang, you can also give your comments or if you have questions for one of the presenters.
Si Marilo Dikenga, yes, cerebral palsy po. Pero magandang cerebral palsy. Wala po intellectual disability. Hindi naman po kasi lahat. Pero there are some. Marami po kami na klaseng cerebral palsy. Ngayon po, sa pagbaba ko sa grassroots namin sa Kainta, marami po talagang ganyan na sexual harassment. Ngayon, ano lang po namin ngayon is yung prevention. Nilalami namin, sana magtulungan kami sa mga panels, yung ipalaganap na yung mga nagseseminar na newlywed, yung magpapakasal pa lang. Sana doon pa lang, nabibigyan na sila ng, isama na yun doon sa kanilang mga siniseminar. Kasi parang walang ganun, kasi ako naman personally kinasal din. So, walang ganong pag-uusap. Walang ganong pag-aaral. Dapat nailagay dito sa kanilang seminar. At saka po yung sa mga teachers. Usually, pag sa SPED, dapat po nasasabi na nila. As of now, may project po akong tuklas aral para sa mga batang may cerebral palsy. Di lahat ko na, kasi habang tumatagal yung studies namin, at yung aming documentations, 1 year in the making, parang sabi ko lahat yata. Kasi yung anxiety, depression, or psychosocial, lahat po pala meron. Hindi lang po specifically sa isang sector lang, so marami po, kasama po kami doon din. So, kung ang mga able-bodied na bata, merong daycare center, sana meron din kami. Yun po yung ginagawa ko kasi may kanya-kanya pong special needs ang lahat ng disability. Nasabi po kanina sa housing, sir, pero po akong project na ganyan. Sad to say, ang NHA wala po project para sa person with disability. Pati po mga developer, Monaco, at yung ating pinakamayaman, alam niyo na kung sino, wala po silang guidance. Kahit sana sa full doors na accessible housing, diba wala? Sana matulungan niyo kami mailagi sa kanila. Ay, makakatulong naman po you know why? Magkakaroon sila incentive sa BIR. Siguro hindi nila alam na wala silang gano'n. Pero sana meron. Kahit po, hindi naman namin we're not asking for much. Lahat naman tayo dadaan sa ganitong sitwasyon. Ako na lang kami naupo sa wheelchair. Pagiging senior din tayo lahat. Di ba? Yun lang po. At yung transport accessibility for pregnant and ating mga senior citizens. Ang mga bata, usually yung mga bata nag-aaral. Kaya hindi makapag-aaral kasi yung accessibility wala. So yan natakal naman po yan dito. Sana po hindi tayo dito na natapos. Sana hindi tayo puro usap-usap. Ilamin natin. Kasi po, andyan na lahat ng batasyo implementation na lang. Sorry kung may government official tayo sa atin. Pero yun po talaga yung nakakalungkot. Hindi man po ako college graduate or with their degree. Pero sa pagiging PWD ever since, yung tanong ko, ang laki-laki tanong bakit ako, bakit ako, Lord? Yun pa lang yung issue na to. Pinag-aralan ko ever since I was a kid. Ano ba yung kailangan ko? Ba't ako nandito? Ba't ito yung binigay sa akin? I'm a happy volunteer. Wala po akong work na amo na pinagpiling. Wala na freelance artist with my husband here. I was blessed with my husband and my kid. Siguro yun yung bigay ni Lord sa akin. Kasi ito yung ginagawa ko, nandito ako wala akong pinikita, pero tulong ako ng tulong, usap ako ng usap, kung may kailangan, yung mga PWDs, pwede ko i-connect pwede ko i-connect sa inyo, sa mga lawyers, yung kailangan nila, and then happy. At sana po, kaisa po tayo, matulungan natin yung next generation na kasi ako, retire na rin ako. Siyempre, papasok ko sa mga Gen Z. Sana po, matulungan natin sila. Thank you so much.
So, yes, related.
Actually, comment muna dun sa pinresent po ni Professor Gomez, no? Kasi actually, kami ni Laguilles, we're part of a sexual health empowerment program under Oxfam, yung arts-based adult research. Anyway, we went to Kalinga Daycare Center, yung ano po ng and discuss kami ng about sexual health, no? To kids na 4 years old ba yung minimum? Yeah, 4, no? 4 to 7, no? Pero one of the things that we found out for my particular session on creative writing, yung ginamit ko na method, sinanina sa movement, is that a lot of kids don't actually know the body parts, especially yung body parts, yan na ano. Meron libro naman na lumabas yung ako ay may tiki na, pero karamihan sa mga bata, hindi alam yung body parts nila na to. And it actually has led, studies have shown, na not knowing the body parts have actually led to yung, made them prone to sexual abuse, kagaya ng mga pinag ko mo kanina. So yun lang po yung comment ko, parang alala ko lang po kasi yung ano namin. Pero yung question ko naman ngayon, kay Cristel, Ansha, no? And as well as Golden, pinag-iisipan ko lang kasi yung self-perception. Kanina na-mention mo, some people actually know what microaggression is, and some people don't know what it's about. So, nakita mo ba kung may connection about self-perception regarding, and their attitudes actually, about their particular impairment or disability? Tapos sorry lang, Cristela, yung tanong ko rin naman kayo, I'm all about self-perception. Yung sa mga mothers experiencing, yung sa mga mothers, naging mother teachers mo. Meron kasi ako mga narinig, of course, this is anecdotal. But did they ever experience self-doubt when they started their foray into, parang, it's a big deal, diba? Biglang suddenly, sabi mo nga, kailangan nilang mag-aral. And then, after the experience, did their attitudes or their perception of self-worth, did it eventually change? So yun yung question ko sa dalawa. May mga questions ako sa iba, pero
Sige po, salamat po, no. Sagutin ko po based dun sa kami ginagawa po pag-thematic analysis namin. Definitely meron, pero hindi namin naisama kasi parang kailangan pa namin maghanap din ng susunod. Pero just to share, meron, tapos merong mga accounts na sa tingin namin na-internalize na nila. Na parang na-justify na nga nila kung bakit sila bakit sila ng microaggression. So yun din gusto namin tingnan na parang angle. Kasi sabi nila ngayon, hindi na sila ganun ka-bothered. Pero hindi ba dahil, kasi sabi nila, na-empower na sila. Pero yung na-empower sila sa mga safe spaces na meron sila. Kasi ang limitasyon din ng aming data gathering ay nasa loob na po lahat ito ng isang organisasyon sa lahat ng walang hangganan. So, ibig sabihin doon, meron silang peer support, tapos shared struggle, collective struggle. Pero pag lumalabas sila ng tahanan, kahit may pinakamalapit lang doon na supermarket or mall, parang, in-accept na lang nila. So parang minsan tinatanong ba nila, siguro dahil hindi na ako, pag halimbawa, sa hypersexualization, yung iba, nakarelate. Kasi conventionally, maganda sila. Tapos yung iba, hindi nila naranasan yung hypersexualization. Na parang nagbibiroan sila, sana maranasan ko rin. So, ibig sabihin, hindi ako maganda, hindi ako conventionally maganda. So parang ano nila, parang isang sisisi siguro so ano yung impairment na meron sila at doon sa itsura din nila kung hindi pumakasa quote and unquote sa conventional beauty standards ng babae. So parang mas ganun po ata siya. I don't know if I answered your question, but we're looking at internalization of microaggression and then we're also looking at ano yung kayang ano nila, parang perception din sa labas. Kasi nga, they're confident, they're super confident to talk about microaggression kasi nasa ano sila, supportive environment. But they're pretty sure, so I ask a comparative question, rhetorical lang, no? Ay, hypothetical. What if wala kayo sa tahanan? Sabi nila, siguro, na-depress na sila. Siguro ay hindi nila kinaya yung mga pang-araw-araw na daily tortures. That's how they describe it.
Thank you. In my case, the question will from mom artist. Actually, the final manuscript, we also had that findings, and it revealed that one is, even though that there are professional teachers already, there is tendency for them hesitation at how can they teach their own kids, especially that they were, one instance, majority of our participants are secondary teachers. So, magkaiba yung pedagogy ng secondary teachers compared to the early childhood teachers. So they're trying to be more probably aware of how their kids learn, and they're trying to even ask with the teachers of their kids on how to better suit their pedagogy for their own children. That's why they're also learning while their children are learning. But also, in terms of the digital aspect of the distance education, sila din mismo natututo on how to use the Google Classroom, how to use Zoom, how to open Zoom. So, parang in some ways, parang sila natututo in how to manipulate the different aspects of the distance education. But as this distance education progresses, they tend to learn more about the characteristics and the learning habits of their children and how they can try to probably align and pattern their choices, pedagogical choices to what their children would want and would need. So parang may progression din doon. Mostly of what we learned and mostly what we gotten from the interviews are mostly the behavioral and yung mga learning styles na tututunan na nila na parang okay, learning style ng anak ko. Ito yung gagawin natin. We will back on this type of learning style na meron siya. But yun nga po parang katulad I think during the pandemic, kahit anong galing mo as a teacher, magaling sa anak mo, hindi mo rin alam that I'm not speaking as a mother. I'm mothered. But ang natutunan daw nila is kahit anong alam, as a teacher, kahit anong galing mo daw at ang daming pedagogy in your arsenal, iba pa rin yung paano magbabalanse ng isang pagiging magulang at isang pagiging teacher. Do they assert more? Pagdating, may mga discussion din kami na sino ka pagkakausap mo na yung anak mo when you're teaching. So sometimes, nahihirapan silang kailangan ba maging strict ako or kailangan ba mas comforting ako kasi magulang ako. So there are instances of doubts and hesitations in the onset of the pandemic or the distance education. But as it progresses, as the distance education progresses, parang nag-relax sila, natutunan nila kung paano na-align yung kanilang pedagogical choices.
Iba rin yung sa grupa din mo.
Yes, opo. Iba rin po yung dynamics daw po na magkatabi yung magkapatid. So parang, syempre, medyo na-compare na ng mga anak po nila na parang, okay, bakit ganito kay kuya? Bakit daw po ganito yung treatment kay ate? Tapos sa kanila medyo strict. So, ayun.
So may gender din. Thank you po. So we're near the end of our program already. We're near time. So we'll just accommodate one last question if there's one more or wala na. Ask you. Yes.
Hello, siguro meron lang akong very quick note also on social policy when it comes to everything we've discussed. So I noticed that all of the topics we have today, they have certain implications when it comes to social policy. So whether we're talking about gender policy or welfare policy in terms of people with disabilities. And I think it's also very important to highlight how, yes, government can have or can implement different kinds of intervention to address the different challenges faced by the different sectors, specifically women. But I think when we're putting forward recommendations for the government, it's also very important to recognize how these recommendations can have unintended consequences. So first thing that comes to mind, yung 20% discount, for example, ng mga people with disabilities, because you also know from people-to-people relationships that sometimes some people can have parang we can stigmatize people, especially when their disabilities are not as apparent or as visible. So, pag nilabas mo yung PWD item mo, you ask for 20% discount, you have a mental health issue, for example, just, you can feel the pleasing look na parang, hindi naman siya PWD, pero siya nagiging. So, parang merong mga ganong unintended consequence that yes, the government can address, but the government also has to be cognizant of the unintended consequences. So, nababalik din sa gobyerno paano siya mag-create ng social policy. So, sa ating mga research na make recommendations, it's also important. Thank you po.
Thank you. So thank you to all our researchers. Thank you to all our reactors. Thank you for sharing your insights and everyone who participated in the open forum. We'll now go on to the awarding of the certificates. So I will call back our director, Dr. Ylanan, and our deputy director for research and publication, Dr. Prof. Dito na lang. Gulat ko. So we'll call out each researcher and then why will take their role. So we call on Athena, Shireen, Fresco.
Dapat ba? Paano ang ano dito? Oh, then, paano ba ang tamang ano dito? Sorry, bigla akong hinagtrabaho. Lapit na. Sorry, alam mo, sanay mo gano'n. I'm so sorry.
Thank you. Next is Crystal Bruin Ancha.
Kunin niyo na sa akin bago hawakan.
Next is Holden Kenneth Alcazaren.
Ang pinagtrabaho ko.
Next is the plea, Julie Olo, Nina Araos, and Sabrina Gami.
Yay! Congrats, Luna!
Thank you.
And Julia.
Next is Irving Rana.
Ka-align ng iyong research.
And last but not the least, Marie Grace Gomez. We will also award certificates to our reactors. It's just team Sana.
Binibigyan ko sa kanila project.
Salamat.
Thank you for taking the time.
Maria Cecilia Zamora.
Thank you for allotting time to us, Professor Zamora. Teacher bias, let's go.
Hindi na mention yung
Huwag niya sa amin.
Asa reactor? Sabi niya, 20 years old. So, hindi naman kami gawa ng
Thank you very much, everyone. So that concludes our event, and thank you very much. Please, feel free to get coffee and